The greatest blessing in the whole world is being a blessing. When you realize God's purpose for your life is just about you, He will begin to use you in a mighty way. Samestang fortunanya koti marodis magta. Very good morning to all.
Good
Dr.
morning.
Enai, Dr. Jonathan, Mr. Ilad, we welcome you for the seminar. Anishma, everybody is okay? Yeah, you can understand English, right? Yeah, thank you. तुमका समेस्तांक इंग्लिश समजता म्हूण चिंता एखाद्या वेळार डॉक्टरान कांय पूण एक्सप्लेन करतना समजनातल्यार दया करन हात वयर करन तुमकां कोंकणीन ट्रान्सलेट जाय जाल्यार दया करून तिळसूचें. हांव सीमा ह्या आयच्या दिसाच्या भलायकी जागरण शिबिराची कार्यनिर्वाहकी. I am Sima. I will be leading the program ceremony today. दया करून हांव सर्वस्व सहकाराशी येता. कार्य मोठवेंच आसतलें देखून दया करून कोणे मदें उठनासतना येचें. आयच्या कार्याची मांडावळ अशी आसा. पयले हांगा मोठवें वैदिक कार्य आसतलें, डॉक्टराचें प्रेझेंटेशन आसतलें, मागीर डॉक्टराची सवालां जापी आसतली. हांगा 7 जाणांक इन्शुरन्साचे प्रॉब्लेम आसा देखून ह्युमन रायट्साचो फिजिशियन हांगा हजर आसा. ताचेर हांव तुमकां माहिती तुमी काणगेवेत आनी तुमकां कितेंय संदेह आसल्यार तुमी विचारेत. उपरांत कन्क्लुजन और कार्य अखेर जातलें देखून आनी एक फावटी परतून तुमचो सहकार आशेता. आतां प्रेयर डान्सा मुखांत आमच्या कार्याक बरें मागूंक मुखार येता लविना फर्नांडीस. लविना फर्नांडीस ही वेदी तुजी.
ಸೆಳೆಯುವ ಹಸಿರಲಿ ಹೊಳೆಯುವ ಸುಂದರ ಭೂಮಾತೆ. ಕಣ್ಮನ ಸೆಳೆಯುವ ಹಸಿರಲಿ ಹೊಳೆಯುವ ಸುಂದರ ಭೂಮಾತೆ. ಮಾತೆಯ ಮಡಿಲಲ್ಲಿ ಸಿರಿ ಸಂಪತ್ತಿಗೆ ಇಲ್ಲ ಕೊರತೆ. ಮರಗಿಡ ಹುಲ್ಲು ಬಳ್ಳಿಯ ಹಸಿರಂಚು, ಮಳೆ ಬೆಳೆ ಬಿಸಿಲು ಸಿಡಿಲು ಗುಡುಗು ಮಿಂಚು. ಬೆಳಗಿನ ಸೊಬಗಿನ ಜೀವರಾಶಿ ಹಾಯಾಗಿ ಹಾರಾಡ ಪಶು ಪಕ್ಷಿ. ಬೆಳಗಿನ ಸೊಬಗಿನ ಜೀವರಾಶಿ ಹಾಯಾಗಿ ಹಾರಾಡ ಪಶು ಪಕ್ಷಿ. ಹಕ್ಕಿಗಳ ಚಿಲಿಪಿಲಿ ಕಲರವ ಎಲ್ಲೆಲ್ಲೂ ಮಿಂಚಿದ ಅನುಭವ. ಜಯ ಜಯ ದೇವ ಸೃಷ್ಟಿಕರ್ತ ದೇವ. ಜಯ ಜಯ ದೇವ ಸರ್ವಶಕ್ತ ದೇವ. ಜಯ ಜಯ ದೇವ ಸೃಷ್ಟಿಕರ್ತ ದೇವ. ಜಯ ಜಯ ದೇವ ಸರ್ವಶಕ್ತ ದೇವ. ಜಯ ಜಯ ದೇವ ಜಗದೀಶ. ಜಯ ಜಯ ದೇವ ಪರಮೇಶ. ಜಯ 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 ದೇವ. ಜಯ 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 ದೇವ. ಸೂಸುವ ಚಂದಿರ ಬಾನಲಿ ಹೊಳೆಯುವ ಸೂರ್ಯ ಬೆಳದಿಂಗಳ ಸೂಸುವ ಚಂದಿರ ರಂಗು ರಂಗಿನ ನೀಲಾಕಾಶ ತಂಗಾಳಿಯ ಸ್ಪರ್ಶ ಹರಿಯುವ ನದಿ ಅಲೆಗಳು ಕಡಲ ಒಡಲಲ್ಲಿ ಜಲಚರಗಳು ಪರಿಮಳ ಬೀರುವ ಪುಷ್ಪಗಳು ಝೇಂಕಾರ ಮಾಡುವ ದುಂಬಿಗಳು ಪರಿಮಳ ಬೀರುವ ಪುಷ್ಪಗಳು ಝೇಂಕಾರ ಮಾಡುವ ದುಂಬಿಗಳು ಉರಿಯುವ ಬೆಂಕಿ ಜ್ವಾಲೆಯು ಎಲ್ಲೆಲ್ಲೂ ದೇವರ ಲೀಲೆಯು ಜಯ ಜಯ ದೇವ ಸೃಷ್ಟಿಕರ್ತ ದೇವ ಜಯ ಜಯ ದೇವ ಸರ್ವಶಕ್ತ ದೇವ ಜಯ ಜಯ ದೇವ ಸೃಷ್ಟಿಕರ್ತ ದೇವ ಜಯ ಜಯ ದೇವ ಸರ್ವಶಕ್ತ ದೇವ ಜಯ ಜಯ ದೇವ ಜಗದೀಶ ಜಯ ಜಯ ದೇವ ಪರಮೇಶ ಜಯ 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 ದೇವ ಜಯ 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 ದೇವ ಜಯ 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 ದೇವ ಜಯ 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 ದೇವ.
Thank you, Lavina, for this beautiful dance. Ladies and gentlemen, we are about to commence our event by lighting the lamp of knowledge and wisdom. We would now like to invite on stage our guest for the lighting of the lamps. बऱ्या कार्याक वेदीर आसलेल्या सर सायड्यांत हांव बरें मागून ही दिवली जे सेवा ते दिवन आसात ताच्या मुखांत्र तांच्या हातीन तावली दिवली पेटोवन हें कार्य आमी प्रारंभ करुया. I request all the guests to light the lamp. आता आमचे कोंकणी कम्युनिटी इन्चार्ज फादर संतोष लोबो तुमचे तावन ह्या कार्याक बरें मागोवंक दोनूच रावलोवंक विनंती करता.
मुंबईनो बालेके शिबीर कितलें गरजेचें हे अवेअरनेस क्रिएट करचे खातीर इंडियन चॅप्लन्सी ह्या समित्याचें मुखेलपण तशेंच इन्फेंट जीजस यूथ क्लब हे जॉयंट आमी संगतेक आयोजीत केलां. आज हांगासर आमी तुमी आयल्यात आनी ह्या शिबिरांत तावन तुमकां भरपूर उपयोग जातलो म्हणून आमचो भरवोस. आनी हांगासर आमचे सैर आयल्यात तुमी जाणात. आय वेलकम all of you for this small camp. We can call it a medical camp or medical awareness program. We are really grateful to you for giving your valuable time to spending with us and to enlightening us how health is very, very important. As you know, just I want to introduce our people who are here. All of them are working in Israel. for the past few years as caregivers, and most of them are coming from South India. We are coming from the state called Karnataka, and particularly we are coming from a region called Mangalore, and our mother tongue is Konkani. But still we able to speak English, and most of them they speak better also Hebrew. So you can say most of your instruction in English and Hebrew. So on behalf of the entire community gathered here, once again a hearty welcome to you, and we pray that this seminar be fruitful for all of us, and that will guide all of our people who are gathered here. Thank you, and once again hearty welcome.
देव बरें करूं फादर, थँक यू सो मच. आता वेदीर आशिल्ल्या सैऱ्यांक स्वागत करूंक मुखार येता लविना डेमसे. तुवें वेदीर येवन सैऱ्यांक स्वागत करूंक विनंती करता.
Opportunity for all of us on behalf of Indian Chaplaincy, Konkani community and Infant Jesus Kids Club. It's my pleasure to welcome you all today's Health Awareness Seminar. हे हेल्थ कॅम्प वा शिबीर आसा तर हाका कारण फादर संतोष कष्ट तेल्यांचो पात्रापाक बारी हुस्को बरे आशेवन आमकां हे शिबीर करूंक ताणें अवकाश तशेंच कुमक आनी सहकार दिला. फादर संतोष तुमकां ह्या शिबिराक स्वागत मागता. तशेंच सबार दिसांत आमचे खातीर मागून मिसाचे बलिदान भेटयल्या फादर जोकिम डिसोजा तुमकांय ह्या कार्याक स्वागत मागता. We are particularly honored to welcome Dr. Jonathan Bill, who will share their valuable knowledge with us today. We welcome you, Dr. Jonathan. A special welcome to our guest speaker, Yannick Rensler, from Physician from Human Rights. We welcome you, sir. We have a family or best friend here in Israel. Thank you for your care and concern. We welcome you, Ilal. Mrs. Mary Terris is a big supporter to Kids Club. Thank you for all that you do, and we welcome you. We are delighted to have each and every one for you here, and आणि तुमकां सर्वांक ह्या शिबिरांत पात्र घेवन सहकार दिल्यांक देव बरें करूं म्हणटा, आणि तुमकां सर्वांक ह्या शिबिराक स्वागत मागता. Thank you all for joining us. Let's learn and grow together. Health is wealth. Thank you.
Thank you, Lavina, and thank you all the guests for accepting our welcome. आता वेदीर आशिल्ल्या सैऱ्यांक एक मोगाची काणी दिवंक आनी देव बरें करूंक म्हणूंक मुखार येता नॅन्सी.
Kids Club to thank each and everyone. First of all, I thank Almighty God for this beautiful day. When Infant Jesus Kids Club approached Father Santosh regarding the health seminar, he supported and took initiative to happen this seminar. Infant Jesus Kids Club is always grateful to you, Father. Thank you. And we request you to accept this memento. Father Joachim, it's a very good memory that you are with us. Please accept this memento. Our sincere thank you to Dr. Jonathan Brill and Dr. Yanai for your insightful presentation. We request you to accept this memento. Ilad, your presence made us feel like we are family. Thank you for coming. Please accept this memento. We want to thank all the sponsors, parents of Infant Jesus Kids Club and all other well-wishers. Mr. Nadar, we thank you for your support. Sound system दिवन आमकां सहकर्शिल्ल्या मेल्विन क्रास्ता तुमकां देव बरें करूं. व्हिडिओग्राफी केल्ल्या अनिल पालटका आनी फोटोग्राफी केल्ल्या डॉल्फी तुमकां देव बरें करूं. We would like to thank Mrs. Mary. Please accept this memento. ब्रेकफास्ट तयार केल्ल्या जॉय तुमकां देव बरें करूं. फुलांचे बुके तयार करून वेदी सोबयल्ल्या फ्लाविया आनी विकी तुमकां देव बरें करूं. याफो कम्युनिटीच्या सर्व संध्यांक देव बरें करूं आनी तुमकां हांगा हजर आसलेल्या सर्वांक देव बरें करूं. जर आमी कोणायकी नांवां सांगूंक सुकल्या तर तुमकां सर्वांक काळज जाता देव बरें करूं. Thank you one and all.
To take their places with the audience and to start our presentation of health awareness.
I will introduce myself. My name is Dr. Jonathan, and I'm a family medicine specialist or family physician. I see some familiar faces, so some of you may know me from the clinic in Salome. And I thank you. This is the best welcome I get, so thank you for this warm welcome. And I really appreciate it. And thanks, Sima, for inviting me to speak with you. It's really an honor for me. And today we will talk about, when Sima talked about self-awareness, for me it's about health prevention. Prevention is one of the top things we do as family physicians. We don't just treat the disease, we aim to prevent and stop it from even starting or minimize it. And it's a big part of our work, and as family physicians we are the first stop for this. Also, we spoke about this before a little bit. I know some of you, maybe most of you, don't have an active insurance, but what I will talk about today, you don't need an insurance to keep these rules to be healthy. Some of the things we do need insurance for medications, for special tests, or to get the medications at a discount, but most of the things I will talk about today are things you can do without insurance, so I hope you will benefit from this lecture. Okay, so yeah, this is the preview. You can skip to the next slide. Next slide, please. Okay, so I will speak about a few basic concepts and one of the big disease we're trying to prevent, and at the end I hope you will get a few tips on how to improve and prevent disease, and also we will leave time for questions, so if you have any questions about anything related to what I spoke about or not, you can ask me freely. So when we speak about prevention, there are a few types of prevention. Primary prevention is stop the disease before it starts. How do we do it? Vaccines, healthy eating, exercise, no smoking. This is the concept of healthy life to prevent the disease from even starting. This is primary prevention, the most basic type of prevention. Secondary prevention is the type of prevention when the disease may be already started, but we want to stop it when it's at the beginning of the disease, when it's not too complicated. Or slow the progression of the disease, or minimize its complications. How do we do it? We measure blood pressure, we do diabetes checks, blood checks, sugar tests, cholesterol tests, cancer screening, special tests to discover cancer early. This is the type of secondary prevention. And when the third tier is tertiary prevention, where we want to manage a disease that is already established, try to prevent complications and improve the quality of life of a patient with the disease. And that we do with medications for blood pressure and diabetes and cholesterol. And we try to, for example, if somebody has a heart attack, we do rehabilitation. We try to get him to be fit again, to walk and work without any trouble breathing. So that is the type of prevention of the third tier. And today I will mostly speak about primary and secondary prevention. Let's skip to the next slide, please. So I wanted to do a quiz, but I think unfortunately for technical difficulties it will not be possible, but we will do it the old-fashioned way with a raise of hands. So just 3 questions. How many of you in the audience, raise your hand if you did, had a blood pressure check in the last year? You can raise your hand. Nice. Wow, a big proportion. So that's nice to know. And same question for sugar test. How many of you had their sugar in the blood tested in the last year? Less than blood pressure. Understandable. You need the correct machinery for that, or to have an insurance to do it in the Kupa. And I wanted to do a little bit of truth and false questions, so just do a sample of that. My question for you is like this. You will please raise your hand if you think this statement is true, okay? So, blood pressure, high blood pressure always comes with dizziness and feeling sick. Raise your hand if you think it's true. Nice, okay. Same questions for diabetes. Diabetes always has symptoms of feeling sick. Raise your hand if you think it's true. Okay, that was a test. You can skip to the next slide, please. So, I will tell you the answers for these questions in the next few slides. We will talk about, I call it the big 3. So it's blood pressure, diabetes, and cholesterol. Most of these problems, especially blood pressure and cholesterol, diabetes as well in its early stages, are silent problems. That means you can walk around with high blood pressure and not feel it. You will not know it until it's very complicated. In the classic medicine, we call it the silent killer, because it can be without any symptoms until it's too late. Same goes for cholesterol, which we don't feel it. And diabetes can come with a little bit of symptoms when it's already at the advanced stage. Next slide, please. So, let's talk about diabetes. Simply put, too much sugar in the blood, a high level of sugar in the blood. There are many factors for it, but It can be family factors, it can be lifestyle factors, but we can control what we can control, which is the lifestyle factors. We can't control the genetics. So why it matters? Uncontrolled levels of high sugar in the blood can cause heart disease, brain disease, kidney disease, basically anything with that involves blood vessels can be hurt. So this is why it's important. The levels of sugar, I had a different version of the presentation where it shows we want the blood sugar to be between 70 and 99. When it's above 100, it's already considered high. So if some of you are doing home measurements, the best way to measure is when you're fasting in the morning, not after meals, not during the day. And the first measurement in the morning before eating or drinking anything should be between 70 to 99. If it's above, you need to be monitored, you need to get checked regularly or see your doctor. When the sugar levels are very high, we have some warning symptoms. The warning signs are combined: very thirsty, peeing a lot, going a lot to the toilet to pee, always feeling tired. Now, everybody's tired, I'm tired right now, so tired is a very general symptom, but you need to check yourself and see if you're more tired than usual or tired all the time, even if you had a refreshing sleep. So, very thirsty, peeing a lot, tired all the time, and in complicated cases, if you have wounds on your legs, on your hands that don't heal, we need to think about diagnosing and treating diabetes. So these are the big symptoms. How do we prevent diabetes? To prevent diabetes, we control all the lifestyle factors we can control. We do daily walking. We try to improve our diet. We eat more vegetables. I will talk about it in elaboration later. Sugar drinks, Coca-Cola, Fanta, none of that, okay? Try to limit it, think about it as candy. We want to consume as little as we can from it. And of course, if you have insurance, you need to make your regular checks. For people over 35 years of age, that's probably once per year to have your blood tests, or at least a sugar test at the nurse's room. For people with established diabetes, we do check sugar regularly. It can be between 3 months to 6 months to 1 year. And we do regular checks of the feet as well, because when you have established diabetes, sometimes you can't feel wounds and fungus are evolving on your feet. So we need to check the feet at least once per month, if not once per week. Next slide, please. Our next important disease to prevent is blood pressure. Blood pressure, it means the pressure of the blood in our arteries, the amount of pressure the heart pumps the blood in our circulation. Why it matters? High blood pressure, same as diabetes, can cause heart attack, stroke, brain damage, and kidney damage. For those of you who measure blood pressure, because a lot of you raised your hands, a normal blood pressure is under 120 over 80. Now, this is the golden number, but you need to remember a few things. Blood pressure is very dynamic. It changes all the time. You can make one measurement and it's high, and you can measure 1 minute later and it will be lower. So, when you see this number, this is an average of home measurements, okay? If you have a blood pressure machine at home, which you can buy at any pharmacy, these are the numbers you should aim to see. When you measure in the morning, after you go to the toilet, before eating a big meal, after resting, and you make a few measurements, this is the golden number, 120 over 80. If it's higher, it doesn't mean automatically that you have high blood pressure disease, but it means you need to be Same with diabetes, you need to be checked, you need to be monitored, you need to maybe check it more regularly, or if you have a doctor to consult with your physician if you need more regular monitoring, or if it's very high, maybe to take medications. But, okay, warning signs, none. We call it a silent killer. As I said before, sometimes you don't have any signs of blood pressure, but it can cause, in severe states, dizziness, chest pain, headache, blurred vision, etc. Many symptoms. But most of the people walk around with high blood pressure without any symptoms at all. So this is why it's important to get it checked at least once per year. And this is what I write in the prevention part. To prevent high blood pressure, we check it regularly, monitor once per year. Salt in the diet is a very important contributing factor for high blood pressure. So, if you already have established high blood pressure, please make an effort to reduce the salt in your diet. How much? I'm talking about people with established high blood pressure. 1 teaspoon of salt, like a big teaspoon of salt, for the entire day. I know it sounds maybe not realistic, but this is a goal. This is something you need to aim to. So, for starters, don't add a lot of salt to every meal. Second, if you eat outside, if you eat in a restaurant, if you don't cook your own food, try to reduce the amount of salt you put in the dish. Make it half of what you usually do. There are many rules and many tips you can follow to just reduce the total daily amount of salt. And if you reduce your amount of salt, your blood pressure will also be reduced. Alcohol. For those of you who drink the occasional beer, today the recommendation talk about consuming zero amount of alcohol. But again, it's not realistic. I also drink alcohol from time to time. So again, we aim to reduce, we aim to minimize. Not every day. If you drink it, try not 2 beers, 1 beer, and keep a normal level of consumption, which can also bring to high blood pressure. For those of you who smoke, stop smoking. Very simple. Smoking is a contributing factor for all of the disease we talked about, for diabetes, for cholesterol, for high blood pressure. So most of you obviously know that smoking isn't healthy, and if you already have high blood pressure and you're smoking, it is very important to stop. Even 1 cigarette can contribute to high blood pressure, unfortunately. So try to minimize or stop. If you have insurance, there are programs that can help you stop smoking and medications that can help you stop smoking. And if you don't have insurance, there are also programs that can contribute to stop, and that's something that I need to check specifically, but there are a lot of self-help and self-awareness YouTubes on video that can help you start the steps towards stopping smoking. Again, staying active, physical activity. I will talk about how much exactly later. Managing stress, which is also something very simple to say, but hard to manage. But high levels of stress, physical stress, mental stress, also contribute to high blood pressure. And if you have established high blood pressure, you need to take your medications daily. If you take it from time to time, it doesn't work. Blood pressure medication, diabetes medication, cholesterol medication needs to be taken once daily, every day, to keep the effect. Next slide, please. Lastly, from the big 3, cholesterol or lipids or fat in your blood. So when you talk about cholesterol, we talk about the fat in our arteries. There is like a small illustration over there on the right side of a blood vessel, and the yellow part is the cholesterol. So cholesterol builds up in our arteries from a very early age. Scientists think it starts from age 5 or 6, but it becomes dangerous at age 30, 40, 50. Why? because when too much cholesterol builds in your arteries, it can cause occlusion, and it's very, very dangerous when it can cause occlusion in your heart, in your brain. It can cause heart attack, it can cause brain disease, stroke. So this is also one of the big things we try to prevent. This is also very silent. You will not have symptoms of high cholesterol at all. We don't know about it. It can only be detected through a blood test. Also, people usually think that if you're fat, you have a lot of cholesterol. Now, it's true that being overweight, being obese, can contribute to high cholesterol, but not always. I have a lot of thin patients, people that are not obese or overweight, and they have high cholesterol. So this is also impacted highly by the things you eat, okay? Your diet. If you eat a lot of processed food, fried food, you may have high cholesterol. To prevent it, we need to eat more vegetables, more grains, more whole bread, less white bread, okay? Again, same as diabetes and blood pressure, being active, walking and doing exercise. Smoking, again. A blood test should be done between 1 to 3 to 5 years. If you have insurance, it depends on your baseline parameters, on your risk levels. And if you do have established high cholesterol and you are prescribed medication, then yes, taking it daily, every day, to keep your cholesterol down and prevent disease. Next slide, please. Okay, so in this slide I will try to shortly describe how to prevent the disease we talked about with eating healthier. So I call this good foods for eating. Vegetables and fruits. Try to eat, to consume vegetables every day, different colors, different varieties, as much as you can. Fruit is also very good, rich, full of vitamins. And when I say fruit, I mean whole fruit, not shakes, not blended, not fruit juices, okay? Fruit juice is just sugar. When I'm saying fruit, I mean the whole fruit itself. When you eat vegetables and fruit, try to make the vegetables the major amount, and fruit is also very healthy, but we try to keep it to 1-2 fruits per day, and not too much of that because it also contains sugar. It's a healthy kind of sugar, but also we don't want too much of it. So lots of vegetables, fruit also, but in moderation. It doesn't matter if it's fresh, frozen, cooked, everything is good. Fresh contains more vitamins, but any type of vegetable is good. So it doesn't matter, at least consume vegetables as part of your daily diet. Try to consume at least 1 vegetable per day. Proteins. When we speak about proteins, I'm talking about beans, lentils, which are a big part of Indian diet. So that's good, that's a healthy type of eating. When you eat dal, for example, that's a healthy type of food because it contains protein, healthy type of protein. Chickpeas as well. Chana masala, for example, is a good dish, or anything that contains beans. Eggs, fish, chicken are also healthy. Chicken is a type of healthy meat because it's lean. So chicken, turkey, fish are all meats that contain protein but do not contain a high level of fat. So this is why we like to incorporate them as part of the diet. What about red meat? So red meat, steak, beef, hamburgers, stuff like that. So it's a bit controversial, and there are a lot of research and studies about it. Today, the recommendation about red meat is it's okay to consume small amounts that are not processed. What is processed meat? That means ready-made sausages or salami or things that you buy outside like McDonald's. This is processed meat. So that we try to limit to 0. But red meat, like eating beef, eating ground beef or steak from time to time in small amounts is okay. So you can incorporate also red meat in your diet, but not too much. When we talk about carbs, so whole grains is preferred to white carbs, like white bread, white sugar. That should be limited to minimum. Try whole grains, whole breads, oats, and stuff like that. Also, when we talk about healthy fats, so I don't know how you mostly cook your food, maybe with ghee, maybe with butter, which is also okay. Actually, ghee is more healthy than solid butter because butter has solids, and ghee is basically butter without the solids. So ghee is actually healthy. So continue using ghee, but if you're frying food or using any type of other oil, olive oil is very convenient. Olive oil is very popular and can be found in any supermarket. It's healthy, also for seasoning, also for frying, also for cooking. Try to use more olive oil in your food and less other type of oils like canola oil or any other types of oil, soy oil, grapeseed oil. Other oils are considered less healthy and may contribute to the disease we spoke about before. Most important take from this slide is about drinks. Water is the best. Water, the fluid of life. We need to try to stick to water as much as we can. Tea and coffee are also good if you don't consume sugar with it. And all the sugary drinks, we try to limit them to 0. And the last sentence, limit fried, sugary, and processed food. You can skip to the next slide, thanks. Okay, another cornerstone of our healthy habits is physical activity. So, I know most of you are working in physical jobs. It can be cleaning, it can be caretaking, but unfortunately, although those are physical jobs and you do burn more calories while you do it, it doesn't fall exactly under what we need to achieve. The goal, according to the WHO and most health organizations, is 150 minutes per week of moderate exercise. What is moderate exercise? It can be walking, but not walking at an easy pace, like walking at a faster pace, at a pace that maybe it's a little bit hard for you to make a conversation, or at a pace where your heartbeat is a little bit higher. You can feel your heartbeat when it's a little bit fast. So if you walk like do a regular pace, it doesn't fall under those 150 minutes. We need to walk a little bit faster, okay? So how to incorporate it in your daily life? Maybe when you walk to work, when you come back to work, try to walk a little bit faster. If you take a bus to work, try to stop, make one stop before your regular stop to do some extra steps. In your building, if you have stairs, use the stairs. Try to, if you're thinking about maybe taking an elevator or the stairs, take the stairs, okay? Nobody wants to take the stairs, but take the stairs because you will contribute to your daily amount of physical activity without making a special effort. You don't need to put your exercise clothes, you can just do it as part of your daily routine. If you are very active, if you do running, then you can cut your amount of the time you need to do. You can do only 75 minutes per week, so you can do 1 run per week, or 75 is a lot, so 2 runs per week or 3 runs per week, but this is only really for the people who do running or swimming or exercise where your heartbeat goes really fast. And this is extra, but it is a very important part of doing strength training, muscles, okay, with weights. So you don't need weights at your home, you can do basic activities like squats. Okay? Or push-ups. Like this. Doing a push-up. So if you can incorporate 10 push-ups, 10 squats, sometime in your physical weekly routine, it's amazing because it keeps your muscles at the same way they are, maybe building a little bit muscle together with the protein. You're maintaining your body, you're maintaining a healthy lifestyle and preventing disease. That's it. The key message: work keeps you moving, but planned exercise, like taking really 30 minutes to exercise, it also helps your mind, it also helps to manage stress levels. So try to incorporate physical activity into your weekly routine, although it's very hard, okay? Because we are all working, we are all tired, but if you try to, at least, you don't have to reach 150 minutes, 10 minutes, okay? The minimum you can do is already better than nothing, okay? Next slide, please. This is for people already taking medications, so this is just a few tips. If you have medications, keep them in their original packaging, in a dry, cool place, not moist, not warm, not in the bathroom, okay, just a dry cabinet. Take them as prescribed, as your doctor tells you, once per day, twice per day, every other day, just as prescribed. Do not share pills. The prescribed medication only fits the patient it was prescribed to. Try to maintain continuity. If you have a prescription that you need to renew every month or every 3 months, try to come to your doctor, to your physician, 1 week, a few days before it's finished, so you can renew and take it every day. And again, as I said it before, if you take blood pressure, cholesterol, diabetes medication, they only work if you take them every day. If you don't take them every day, the effect can be lost. Next slide, please. Okay, this is an important slide where I talk about cancer prevention. So some of the healthy habits spoke about before are also appropriate for cancer prevention. We talked about alcohol, smoking, things you need to limit. So that's also part of cancer screening. And just wait for the slide to be back. But this, I don't know, maybe you usually need an insurance to complete these tests. But at certain circumstances, some of these tests can also be performed through emergency services, but this is not the point of it. So I will go over it anyway. And okay, we don't need a presentation. Let's talk about it without it. Okay? So if you're approaching age 50, okay? How many in the crowd are you over age 50? Can raise your hand? Okay, good. If you're age 50 and above, the Israeli recommendation, which are compliant with European, American, world recommendations, to prevent colon cancer, okay? To prevent gastrointestinal cancer, is to make a stool test once per year, okay? If you're age 50 and above, stool test which can be done once per year to detect early colon cancer. There is also a test called colonoscopy. Some of you may have heard about it. We take a camera and we look inside the colon to look for early signs of cancer. So this is also recommended, age 50 and above. Before that, we don't offer this test unless you have a history of, a family history of colon cancer, and then we may consider doing it earlier from age 40. Okay? So age 50, this is the age to start for colon cancer screening. Second test is for, colon cancer is for men and women. Now, just for women, breast cancer screening, okay? This is very important. Breast cancer screening in Israel, we start at age 50 as well, okay? From age 50, every 2 years, we invite women to do mammography. Mammography is basically, okay, we're back. So, I'm at the second line. We do a mammogram or mammography. This is recommended for every woman from age 50 until age 74. It's basically an X-ray of the breast. It's not a very convenient test, but it's the best and most available test we have. Sometimes we incorporate it with ultrasound of the breast, and that way we can detect breast cancer early and treat it early. So it's very important to do mammography every 2 years since age 50. Now, if you have in your family, your mother, your sister, your grandmother, you know that you have breast cancer in your family, it's important to tell your doctor because we may want to start screening earlier, okay? From age 40, maybe even before. But the average age that we want to start screening is 50. Another exam, which is done at the gynecologist's clinic, is called pap exam or papillomavirus exam. This is a test to detect early cervical cancer. This is only for women, done every 3 years from age 25 until age 65. It's one of the big screening tests as well. So these are the big three: colon cancer, breast cancer, and cervical cancer. The rest of the cancers we try to detect by symptoms. So next slide, please. These are warning signs. Now, it's really important that you understand that it doesn't mean that if you feel one of these signs that you have cancer, okay? But if you do have one of these signs, please be aware, please go get checked, or at least consult a doctor about it, okay? So for colon cancer, we would expect blood in the stool, but blood in the stool is very general, okay? Most of the people with blood in the stool have hemorrhoids, have anal fissure, they don't have cancer, okay? But if you have blood in the stool with pain, with constipation, with weight loss, with tiredness, if you have all of these symptoms combined and you're above age 50, this is very important, and you're older, you need to get checked, okay, for colon cancer. Breast cancer is usually detected when a woman feels a lump in her chest. So you can examine yourself. There's just an illustration, but usually self-breast exam once per month. You can do it in the shower with warm water. It's even better. After your menstruation, just try to check if you feel any lumps in your breast. Okay? If you feel a lump in your breast, go get checked. If you see changes in your nipple, if you see that the nipple has a discharge, a bloody discharge, any discharge, if you see that the shape is changed, please go get checked, okay? For cervical cancer, it can be also bleeding after sex, bleeding between menstruations, bleeding between periods, but again, most of these signs, if you have bleeding between periods, doesn't mean you have cancer. It just means you need to be aware and you need to get checked. Pelvic pain, unusual discharge as well. So key message, not every symptom means cancer, but don't ignore it. If you feel a lump, if you feel something is wrong, something has changed, please go get checked, okay? And consult a doctor. Next slide, please. Short slide about vaccines. So basically, we have routine vaccinations in Tipat Halav, and we have routine vaccinations for adults. This is for adults. Usually maintain tetanus shots every 10 years, flu or COVID, when appropriate, shots every year. It's a seasonal vaccine, so that means to be protected, you need to get the vaccine every season. Usually starts in October, next month. So flu vaccines will be available if you have insurance since next month. You do it free, it's part of the insurance, and it's very important because it protects you from the complications of flu. Flu can be an easy disease, it can be it can feel like a mild cold, but in some cases, especially if you're already sick, if you have diabetes, if you have high blood pressure, you can get it worse, you can be really sick. So it's important to get a flu vaccination. Hepatitis B is a vaccination we give to every child born in Israel. It's the first vaccine we get. If you didn't get vaccinated,
maybe some of you got sick as a child and you're already vaccinated for life, and some of you may not, and you may still get the disease. So it's important also to get checked. It's a simple blood test, and to know if you need a vaccination or not. And this is more for the older crowd. I'm not sure it's relevant for you, but from age 50 and above and age 65, we also do pneumonia vaccines and shingles vaccine, herpes zoster. It's a skin disease, and they're also available through the insurance. So if you're not sure if you're vaccinated, yes or no, again, consult with the doctor, ask the doctor what type of vaccines do you need to protect yourself. You don't need to be sick for that, it can be a healthy visit. Just come to the doctor and ask about vaccines. Next slide, please. So a few slides about how to maintain your health during work. So it doesn't apply to only people working in cleaning, but just also general rules if you clean your house for lung health. Do not mix cleaners, okay? I have some patients that suffer from lung disease because they mix cleaners. That means bleach, economica, with some type of another cleaning material that has ammonia inside or vinegar, and that can cause fumes. You may see just fumes rising from the cleaning materials, and that is very dangerous. So please, if you use cleaning materials, do not mix, okay? Use the cleaning materials just as they are. If it does happen, please open a window, ventilate, go outside, throw the bucket or whatever it is in the toilet and dispose of it. Always try to work with open windows or ventilation as possible. Gloves and masks if you spray or use any type of economics. And if you have signs like cough, wheezing, which is this sign of if you hear it a lot during your cleaning or you feel you're out of breath, please stop everything and rest, or if it becomes very hard, it's time to call for emergency. But this is very rare and extreme. If you feel you have some type of reaction to cleaning materials, also consult with your doctor, ask your doctor, maybe you have asthma. So this is also a sign to get checked. Next slide, please. If you have a chemical splash, if you got splashed with economics or any type of cleaning material, and it's in contact with your eyes, please go to a faucet and rinse your eyes with running water for several minutes, okay? It says 15 minutes, it's hard to do the full 15, but running water, okay? So if it splashes in your eye, 15 minutes of running water on your eyes, okay? This is very important. And of course, try to get checked after that by a doctor. Same for skin. If any type of dangerous material hurt your skin and you're not wearing gloves and you're not wearing protection, rinse it with water for 15 minutes. Remove that part of clothing, okay? If it's wet, and we don't want it to stick to the body. And if it becomes red, irritated, hurt, go get checked, okay? We talked about the breathing problems in the last slide. If you feel trouble breathing, call an emergency. And do not delay. As soon as it happens, if there is a splash, stop everything you're doing and treat yourself. Next slide. Yes?
Can I ask, if you feel breathless, is it okay to drink milk on the spot?
It's a good question, thank you. So she asked, if you feel breathless, is it okay to drink milk on the spot? So, I don't know about this connection. I think maybe I know about the connection about ingesting. If you're exposed through your mouth to economics or some kind of bleach or something like that, so there is a recommendation to drink milk because it may neutralize it. So basically, the recommendation I give is neutral, okay? It's not good, it's not bad. If something like this happens and you ingest economics through your mouth, you need to go to the emergency room. So drinking milk will not help, it will not hurt. Anyway, do not do it in big amounts. You can drink like a sip, yeah, a small sip, because I don't want you to vomit. If you vomit, you will maybe burn yourself again, because basically it's like a chemical burn. So if you ingest some type of economics or it happens to your child, do not try to get milk, do not try to drink water. You just do one thing. You call 101, that's MADA, Magen David Adom, that's emergency services, or you go directly to the hospital. Okay? Next slide, please. Okay, this is important for everybody, not only people working in cleaning and caregiving. This is how to protect your back at work. It doesn't matter, even for young people, older people, back health is one of the biggest issues I see in my clinic. So one of the biggest tips I can give you is to, when you're lifting heavy things, is to bend your knees and not your back. What do I mean? I'll try to present you. So if you're lifting something heavy, I will do it as such, okay? And not like this. Now, not every time when I lift things I bend my back all the time, but if you do it repeatedly, okay? If it's part of your daily routine, your daily work, do try to lift things with your back straight and bent knees, okay? It will strengthen your back and it will protect your back. So I'll just show it again, just from the side. Okay, try to keep your back straight and with your knees and lift whatever it is you're lifting, okay? Not always possible, but try to stick to this rule. Keep your load closed and avoid twisting. Keeping your load closed meaning like this. When you lift something, you keep it close to your body and not far away from your body. Take micro breaks each hour, okay? During your workday, take the break, okay? Step aside, do stretching, stretch your back, stretch your arms, stretch your legs. It will prevent injury and it's good for maintaining your back health. Wear good shoes, okay? Shoes and feet are connected to our back health. If you have back problems, it may be connected to the fact that you have feet problems. So you need to check that you're wearing good shoes with a good pad for your feet, okay? This is also part of your healthy back. And again, water. Try to carry a bottle of water for work, and the golden number is 2 liters. 2 liters per day. This is what we try to aim to. It's also a high number, but don't be dehydrated. Don't work all day without drinking water. Water is the best thing you can do for yourself. Next slide, please. Skin and hands. So if you work with chemicals, please use gloves. That's obvious. When you wash your hands, wash it with a mild soap. And if you see that you have cracks and blisters and your hands are very dry, please use a moisturizer every day. So you don't need a prescription for this, you just buy this in every farm store, moisturizer. But if you see that you have cracks and redness and calluses like hard skin, please come see your doctor also, because you may have a type of reaction to the cleaning materials. And this is something we treat with special creams, with steroids. We give steroids for a limited amount of time, 1 week, 2 weeks, and then it can help maintain your healthy skin in your hands. Next slide, please. Okay, this is also a very important slide. It's about your mental health and your sleep. So, anybody who is an immigrant, who doesn't live, or a foreign worker who lives in a different state, has some kind of level of stress, and it's normal. It's normal to be stressed, it's normal to be homesick, and we do aim at night to sleep at least 7 hours. Okay, 7 to 8 hours is the good amount of sleep. 6 hours can also be okay, as long as it's a good refreshing sleep. If you drink tea and coffee at night, try to cut it, try to drink your last coffee or tea around 6 p.m. or 7 p.m., okay? But most importantly, I want you to know that as family doctors, part of our job is to treat your mental health issues. So that means depression, anxiety, sad mood, extreme level of stress. If you feel any type of that problem, that's also good to talk to your doctor about it. Okay, please tell him about your mood. If you're feeling down for over 2 weeks, if you feel that there is no hope, if you feel very sad, please talk to your doctor about it, because we can help. With the help of also psychiatrists and psychologists, but at first we can help you with first aid, and that's also part of our job. Okay, so please, the key takeaway message from this slide is, if you feel very sad, a family physician is also a good place to talk about it. Next slide. Okay, emergencies. When to call an ambulance or when to go to the hospital. So, emergency services in Israel is 101. When things get very hard, like chest pain during exertion, if you feel you're going up the stairs and your chest starts hurting and it doesn't stop, and you rest and it doesn't stop and it still hurts, and it comes with vomiting or nausea or sweating and it's hard for you to breathe, that can be a sign of a heart attack. So I would be very happy if any of that happens to you. You directly call an ambulance, you don't hesitate, okay? Worst case, you cancel the ambulance if you feel better, or you don't go to the hospital. But I would be very happy if you feel this type of pain, chest pain, with nausea and vomiting and sweating and trouble breathing, that you call an ambulance and get checked on the spot, okay? This is an emergency. Other troubles of breathing emergencies, like very dangerous asthma or other complications of high blood pressure. If it's hard for you to breathe, you don't hesitate, okay? You call the emergency services. If you have mild trouble of breathing, but you can walk, you can do your daily activities, so that's not an emergency, that's something to get checked in the doctor's office. But if it's very severe, please, do get checked, do call an ambulance. Fainting, if you lose consciousness, that's always a good sign to get checked in the emergency department to clear for any type of emergency that can cause the fainting, okay? So fainting, loss of consciousness, also an emergency. Signs of stroke. So the slide here, there's a mnemonic, it's called FAST. The meaning of FAST is face drooping, arm weakness, speech difficulty, and T is time to call 911, but in Israel it's 101. So this is FAST, okay? If you see all these signs, face drooping, arm weakness, and difficulty speaking, especially at the person over the age of 50, it can be a sign of stroke. This is an emergency. In an emergency, you call 101 and we go to the hospital immediately. Okay? Try, if you have any type of medical history or if you take medications, please bring the list with you when you call the ambulance. Okay, so we're nearing the end. Everything we talked about is summarized in this health checklist. I also sent Sima, she has the presentation which you can view as you wish, but also this small checklist that you need to check with yourself, okay? So, no tobacco, no smoking, limit alcohol, try to walk 30 minutes at a good pace almost every day, most of the days of the week. Try to incorporate some kind of strength exercise. Food, eat more vegetables, eat more protein, less sugar, less white carbs, less processed foods. Try to drink at least 2 liters of water per day. Sun protection, it was in the part of the cancer prevention. Hat, sleeves, sunscreen. The most dangerous hours of the day are between 10 o'clock and 4 o'clock. Try to avoid direct sun contact between these hours. Or if you do, wear protection. We talked about work safety, we talked about gloves, don't mix cleaners, lifting safely, taking breaks, doing stretching, sleeping 7 hours per night. If you take medications, take them as prescribed. Check your blood pressure once per year. Check your sugar, cholesterol as told, or at least once per year if nobody else told you otherwise. And cancer screening test, depending on your age and sex. If you're younger than 50, then it's only relevant to women, and cervical screening. So please take this list and check with yourself, what are you doing, what are you not doing, and what you can improve, and aim to be around this, okay? Next slide. That's it, thank you very much. If you have any questions, I'm happy to hear.
Kurang kisah saya mau sang cinta. Now I request our physician from Human Rights to come and speak about health insurance issues and about health insurance.
No, I mean, can you hear me like this? Yeah. Yeah, okay, great. So my name is Yanai, and I come from an organization called Physicians for Human Rights. Does anybody know our clinic in Jaffa? Our open clinic? Have you been there before? No. Some yes, some no. Okay, okay. So we're an organization that focuses on the right to health, right? Kind of the belief that every human, as a human, deserves a right to be healthy. Now, everything that Dr. Jonathan said is the most important aspects of being healthy, but every human has a right to not only kind of have access to healthy food and the ability to do exercise and to breathe clean air, drink clean water. Also, every human has the right to see a doctor when they're sick, or to see a nurse when they need help, when they need nursing help, right? That's a human right. And so in our organization, we focus on the right to health of every human, no matter where they come from, no matter what their beliefs are, no matter what gender they are, no matter what, every human has a right to health. And that's what we do as an organization. Our open clinic, okay, the clinic that we operate, that our volunteers operate in Jaffa, it provides direct medical care only to adults, free medical care to adults, some specialist care to adults as well, right? To children, I'm going to get to children a little bit later. For children, there are other possible ways to receive medical care. But I guess the first thing that I'll say is at our open clinic in Jaffa, if you're an adult, if you don't have health insurance, then you are able to come to our clinic. We provide medical care, regular kind of family medicine, family medical care on Sundays, Tuesdays, and Wednesdays from 3 o'clock p.m. Okay, I'm going to send Seema some information afterwards so that she can send it to you, on WhatsApp, email, whatever, right? I'm sure you've got some really stuff. Yeah, but Sundays, Tuesdays, Wednesdays, you're able to come to our clinic to receive care. If you don't have insurance, that's the family doctor. And then on Mondays, we have specialists. On Friday, we have women's clinic, right, for prenatal care, for pregnancy, for other women's health. The types of specialties that we have, they vary at our clinic. It's everything from physical therapy, eyes, nose, throat, gynecology, gastroenterology sometimes, nutritionist, psychiatry. We actually have child psychiatry at the clinic as well. So if you're interested in coming to our clinic, again, for adults, 18 years and above, if you're interested in coming to our clinic for medical care, I'm going to send the phone number to Seema afterwards, and we would love, obviously, to serve you the best we can. Okay, that's our open clinic at Physicians for Human Rights in Jaffa. Again, for those who don't have health insurance and are above the age of 18. Now I'm going to move over to everyone else, right? I'll try to do it kind of in a couple of minutes and as concise as possible. And then, of course, if you have questions now, please feel free to ask. If you have questions as I'm speaking, please feel free to ask as well. And of course, through Seema, through Elad, you can also kind of send questions and we'll do our best to try to provide responses as well. Okay? Now, what are different systems for health insurance in Israel? I'm first going to speak about, I'll speak about kids or adults. Which one first? Adults. All right. So I'll speak about adults first, and then we'll get to children in a couple of minutes. All right? Now, for adults, as many of you know, right? If I have a job, okay, then my employer is required to organize health insurance for me. Yeah? Is that something that's familiar? Yes. Cool. Okay. Now, health insurance is always better, obviously, than not having health insurance. And so it's important to ensure, right, to make sure that the health insurance that your employer has arranged for you, right, is established, that it's valid, that you have your insurance card, right, that you know where the closest clinic is, that you have a family doctor, right, who you trust, who you can go to when you're sick. The medical insurance that's provided through an employer is the best program for adults who are here. That's the best system, and it's by law. It's your right. By law, as an employee, your employer is required to make sure that you have access to good health insurance, right? Now, there are some cases where health insurance won't be an option, right? So, number one, if I don't have kind of like a full-time or official employer, right? And then it's not the type of work that establishes medical insurance for me, then I might not, again, have that health insurance program through the employer. If I lose my job, right? If I don't have a job, then I'm also likely to lose insurance, right? So, what can I do if I lose my job and my insurance gets canceled by my employer? Number one is it's possible to extend your health insurance by 3 months. Okay? It's possible to extend that exact same insurance by 3 months. Okay? And that 3 months, those 3 months are supposed to be kind of the glue between one job and the next job. Okay? So it's very important if you're moving from one job to the other, or if you lose your job, to try to make sure that the health insurance that you were on from the employer gets extended. And again, if you have any questions about that, then please, you can reach out to us, you can reach out to Elad. A lot of the organizations are there exactly to help sort of in those moments where if you're moving from job to job, to make sure that you keep your health insurance. Because what happens if my insurance gets canceled and then I don't have insurance for a period of time? So of course if I get sick during that time, or if I fall, if I get into an accident, then I won't be able to use the insurance. But also, I lose my medical history, right? So if I have what's called a pre-existing condition, if I've already been sick, if I already have back pain, if I have asthma, if I have diabetes, if I didn't kind of connect between the insurance programs, I didn't extend it for those 3 months, so then the next time I go to open insurance, the insurance provider will ask me, they'll do kind of that checklist, right? And it's important to give their medical history. And then once they find out that the patient that you have, whether it's a bad back or diabetes or, God forbid, cancer or a different kind of illness, then that's a condition that then won't be covered through the insurance, right? So that kind of continuity of insurance is the most critical piece, right? And again, if you have any questions about that continuity, again, please reach out to us, reach out to Elad, Kabla Obed. Do you know the organization Kabla Obed? They're the best? Great. So yeah, always kind of reach out with those questions, because that's the best way. It's also the way that we learn on our end and in the organizations, but it's kind of the best way to work out some of those issues, right? Now, there are other scenarios where, again, health insurance, where you don't have health insurance, where health insurance isn't possible, and then there are other options, right? So you can either come to our clinic. There are other private clinics to go to, Terem, Mikro, there are other places where you're able to go to pay privately. Hospitals have outpatient clinics where you're also able to do some tests. At our clinic, for example, we're not able to do, we don't have a lab, so blood tests we're not able to do in our clinic. Some more complex procedures we're not able to do in our clinic. And so those, if you don't have insurance, you would have to go to an outpatient clinic at a hospital or a private clinic that is set up to do those things. Now, probably the most important thing, what I should have said at the beginning, but what do you do in emergency? Just like Dr. Jonathan said. So you go directly to the emergency room. In Israel, right, the emergency room is required to provide care to somebody who's facing an emergency no matter what, right? Whether you have insurance, whether you don't have insurance, the hospital is required to provide emergency care to you. Adult, child, grandparent, grandchild, it doesn't matter. If there's a medical emergency, no questions asked, you go directly to the emergency room. And again, if you have any questions, if you feel like they're not giving you the care that you need, then you reach out and we'll try to do our best. We'll try to do our best to help. But the emergency room is where we go when we're in an emergency, no matter what. Right? It's a risk that we don't take, and the emergency room is required to provide care for you. What are some of the close hospitals to here? Okay, what else? Wilson, okay. Medicine, cool. Do most of you live in the Tel Aviv area? Yes. Awesome. Okay. Yeah. Those are exactly the hospitals. Shiva's another good one, but yeah, there are a bunch of hospitals, and that's where we go when there's an emergency. Okay. There are other open clinics or volunteer clinics in Israel. If you find yourself in Jerusalem, right? If you have some work to do in Jerusalem, or you're visiting family, or you're visiting the city, and you need to receive medical care, there's a free medical clinic in Hadassah Hospital. It's called L'Reacha Kamocha Clinic. Okay, and that's another clinic. I can give the information to Sima. And if you're in the Haifa region, in Haifa up north, there's the Hafta Clinic. There's another one as well. Okay, so that's adults. Again, most important, if you have health insurance, to make sure that you have your insurance card, that it's valid, that you know where to go, that you have a family doctor.
I just want to ask, in case in any emergency, usually once I got an experience, when I called the ambulance, they told us you need the doctor's, nurse's letter.
Yeah.
Because when you get admitted, you need to pay for the emergency, and when you get discharged, the insurance when we give, they say you won't get the money back because you didn't get the doctor's information or nurse's so what you can do?
Yeah. So I want to describe two scenarios, two emergency room scenarios. Okay. One emergency room scenario, right, is like Dr. Jonathan said. It looks like I may be suffering from a stroke or a heart attack, or my spouse, my wife, my husband, my child, somebody is in a real medical emergency, right? And in that situation, whether it's calling a cab, calling a taxi, calling an ambulance, having a friend drive, whatever, I get to the emergency room as fast as possible. That's the most important thing, right? There's another type of emergency room visit where I have some time, right? I have a couple of hours to get to the emergency room. It's an emergency, it's a medical emergency, but I have some time. Now that's a situation where to make sure that I'm going to receive reimbursement, in order to receive reimbursement, so then yes, it is critical to get the letter from your family doctor, to have the prescription. A lot of the time the medical visit, the emergency room visit will happen because I went to the doctor, I saw Dr. Jonathan or my doctor, and my doctor said, your blood sugar levels are scarily high, or your blood pressure is too high, or we're seeing some scary blood test results. Go to the emergency room, and so then that's the situation where you would bring your prescription, and then that will help with the reimbursement afterwards. Yeah? Cool. Okay. All right. Any other questions about adults before I move to kids? Yeah.
Once we go to the hospital in emergency, the twins, if it's a serious matter,
It's a really serious
Is
matter.
they going to reduce the bills in the family?
Yeah, so no, you're asking a very, very good question. So they're required to provide medical care, right? But it's true that afterwards they will come kind of try, to make you pay for the care that you receive. Now, and if you have health insurance, then you kind of push the health insurance. Sometimes the health insurance, they'll like give you problems, they'll try to argue and get their way out of. That's the situation where we do our best to make sure that the health insurance will pay for it. Now, if you don't have health insurance, right? If you don't have health insurance, then the emergency room, the hospital will try to get you to pay. Okay? Now, as you may have heard, sometimes, eventually, they just forget about it. They let it go, right? There's no way for them to go into your bank account or to force you to pay. They can't arrest you for it. So sometimes, eventually, the hospitals do forget about it and they let it go. Other times, if it's close to a cost that you're able to manage, sometimes you can say to the hospital, listen, I can't pay the full amount, but I can pay a smaller amount, or I can do a payment plan, right? So sometimes they'll let you pay every month another 200 shekels or another 300 shekels, and then eventually you're able to cover the cost. So sometimes that's the recommendation, is to try to come up with an arrangement with the hospital, because the hospital understands that it's either they get something or they get nothing. So if you're able to pay something and negotiate with the hospital, sometimes that's a helpful solution. Yeah. All right, should we talk about kids? I know everybody's probably ready to go. It's been a long morning. So let's talk, yeah.
This guy had an insurance and he has undergone the surgery.
Yeah.
After 2 years, they're asking for 2 lakh something bill.
Yeah.
How could it possible?
So again, it's like each case is separate. It's like a case-by-case basis. But so what needs to happen in that situation is you take the hospital, you contact us, or Kavla Oved or Elad, one of the organizations, right? We're here to help, and you send us the medical bill. Right. So we would look at the bill and the medical insurance, and then we would contact the health insurance company. You can do it as well, right? So contact the health insurance company and say, hey, I had this surgery when I had health insurance. You're supposed to pay for it. Why didn't you pay for it? And yeah. So yeah. So again, the health insurance is required to pay. Sometimes if it's something where there was already a medical condition, right? If it was what's called matzav b'riut kodem, a pre-existing condition. So then maybe they wouldn't cover it, but you have to check first. That's the situation where you would need to check the health insurance and to contact the health insurance company to try to get them to pay. Yeah? Okay. All right. Now quickly, kids. I know everybody's kind of ready to go. But in terms of kids, okay. Does anybody have children who are now on Leumit health insurance? Okay. Now, exactly 1 year ago, there was a change in Israeli law, in Israeli policy, and they moved children from Meuchedet, from the clinic, from the Kupa, where Dr. Jonathan works, and they moved them to Leumit health insurance, okay? Now, number one, that's obviously challenging because it's moving kids to a different system, different doctors. Leumit doesn't have everything that they had in Meuchedet, right? But the other problem, the bigger problem, is that the government took away the right for many of the children, right, to establish health insurance in Leumit. Now, for kids who were already in Meuchedet, they could move to Leumit. But for babies who were born after the change in the law, and they are children of parents who are not from a few countries, Eritrea, Sudan, Ukraine, where refugees, asylum seekers are coming from, but they're from any other country in the world, and their parent, for example, doesn't have a valid work visa, so then the children are not eligible anymore to do health insurance at Leumi. Okay? So new babies who are in that situation now are vulnerable to not being able to establish health insurance at Leumi. At Leumi, it's also expensive, right? It's 140 shekels per month, and we know that this is an expensive price, of course, for many families. It's unfortunately in the law, that's the price of health insurance for babies, for children in Leumi, right? And the other kind of tricky thing with the price is that if you don't pay the bill for the children, and after a few months they'll cancel the insurance, and then once you are able to pay, there's going to be what's called 6 months of waiting time until the insurance. Like during those 6 months, you can go to the clinic in the neighborhood, you can see the family doctor, if you need to go to the emergency room, that'll be covered. But for things like surgery or seeing specialists, that you have to wait 6 months for. So kind of making sure to pay those monthly payments for children who are in the need is the most important thing. Okay? Now, children both insured and uninsured, when they're born, where do you take them? Tipat Chalab, right? Tipat Chalab, there are many of them all over Tel Aviv. Tipat Chalab is required, right? Tipat Chalab is required to accept all children no matter what. Yes insurance, no insurance, yes citizen, no citizen. They don't ask those questions, and that's where they give children their vaccines, right? It's critical to go to Tipat Chalab to get all of your vaccines for free, and also to get examined by the doctor there. Now they don't like give medicine there, they don't kind of do sort of most of the things that a pediatrician, a child doctor would do, but they do like a very basic exam that at least helps you know kind of the health status of the baby. Okay, so it's critical, baby's born, we go immediately to Tipat Chalab, we find the one that's closest to where we live, and we get on schedule with our vaccines. Okay? Children who don't have health insurance, okay, are able to go, there's a clinic in the city of Holon called Bikur Ofe, okay? Now Bikur Ofe, as kind of talked about this with Elad, sometimes they're a little bit hard to work with. For newborn babies, they may not be willing to accept them because they often don't have a pediatrician on staff, but for children who aren't, like they're no longer, like they're not a month old, they're not 2 months old, they're 6 months old, they're 1 month, they're a year old, they're 3 years old, right? So you can bring them to the Bikur Ofe clinic, and it's 40 shekels for an appointment at Bikur Ofe, okay? And they actually have some specialists at Bikur Ofe as well, okay? So that's a place where children are able to go to a pediatrician if they don't have health insurance. It's called Bikur Ofe Clinic, and it's located in the city of Holon, okay? It's East Stadrut Street, number 35, okay? Now, for children who don't have health insurance, there are some private health insurance programs, okay? If your children don't have insurance or they're not eligible for the UMIT, and you're interested in learning more about private insurance programs, so then you can reach out to the different health insurance companies. One good way to do that is if you have health insurance through work, you can contact the health insurance company and ask them if you're able to purchase health insurance for your children through those companies. Meuchedet, I think, has a program for children as well, but those are things, it's private, so it's not something that, kind of, we know the details about. That you have to do vis-a-vis the insurance companies. And again, each hospital in Israel has outpatient clinics where you are able to receive care privately. There are hospitals also in East Jerusalem where sometimes the care is a little bit more affordable. And then there are the other free clinics in Israel, the one in Jerusalem, in Hadassah Hospital, there's Ve'ahavta, okay? Dental care, dentistry, right, for children, okay? The city of Tel Aviv just opened up a new dental clinic in southeast Tel Aviv, in the Ezra neighborhood. Again, there's a flyer for it, and I can send it to Sima. But children above the age of 8 are able to receive free dental care, many services at this new clinic. Okay, so that's an important new service. There's also a dental clinic at Tel Aviv University, okay, that also provides heavily discounted dental care kids. Okay, so again, that's information that we can provide as well. Dentistry tends to be expensive, but it's important. It's still important to do proper dental care, and often taking care of the problem early on prevents more serious problems later on. Okay. Any questions about where kids can go to the doctor or how kids can get health insurance? Okay. So maybe the last thing that I'll say with this I think I'll end is that, you know, in our clinic we provide the care that we can. We try to help if there are specific individual instances where people, you know, where the insurance company isn't paying properly, or where the hospital is, you know, chasing after you and trying to make you pay to help you figure out what to do, right? We try as best as we can to work with doctors like Dr. Jonathan or doctors in hospitals. We have doctors that we know sometimes that they're able to provide discounted care. We go together with, you know, we have other services that we're able to provide in our clinic as well. But alongside what we call kind of the individual, working with individuals, we work very hard to change, you know, to change the laws, like to change the policies. We're not the government, but we try to put pressure on the government so that they will recognize the universal right to health, so that they will change laws to enable every human, based just on being human, and especially children, and especially people who are vulnerable, to advocate so that they will have access to health. That's our commitment, you know, to you. We think that's what every human being deserves, and all who are here in Israel especially. These are fights that sometimes we fight, you know, in the Supreme Court, in the Israeli Supreme Court, or, you know, with the Ministry of Health, with the government. A lot of the time it is helpful to us, you know, to understand cases where, you know, where the health insurance company didn't pay, or the Umid isn't providing the care that your children needs. Sometimes, you know, we'll do our best to help in that individual case, but sometimes it's also important for us to know, because that's the evidence that we're able to provide to the government to say, hey, look, there are children here in Israel, they're living here. Their parents are doing their best to make ends meet and to do their jobs and to do their work, but the kids don't have access to care, or the adults are sick and they don't have access to care. Okay? Sometimes when you provide those stories to us, then we're able to do our best to learn from those stories and to try to translate them into advocacy work, to do the best that we can to fight for you so that the laws will change and that everybody, based just on their humanity, will have access to care in the Israeli healthcare system. That's all on my end. Do you any more questions? Yeah, of course.
I have an overall question.
Of course.
In your medical insurance, overall, is your dental insurance also covered?
So I don't have health. We don't offer health insurance because we're like an NGO.
If you have a medical insurance,
Yeah.
it's covering up everything.
Yeah.
But is your dental insurance covered, or it's a separate insurance? that
It's
you are
a separate insurance. You're saying like for an Israeli, you mean?
Not for India, for India also.
Yeah. Okay. So yeah, dental insurance is usually not covered
In the medical insurance.
in the medical insurance. It's not covered. It's, you know, like there's medical dental care that sometimes can be, you know, it's like a dental emergency, and Dr. Jonathan probably knows more about sort of what.
Basic stuff that are included. So in basic insurance, you do have a doctor check, hygienist. It is included. Like for advanced like surgery, implants, stuff like that, usually requires expert help. But basic level of insurance, like a doctor check, hygienist, maybe do a filling of tooth, it is included in the medical insurance. Yes.
And for children in the UMI, so dental care is included in the UMI. Okay. And one more time?
What is the address?
So it's the street is called Baruch Sapir, BARUCHSAPIR, number 4. Okay? Okay. Thank you very, very much, everybody.
Thank you, Doctor. तुमकां पुराय समजला म्हूण चिंता आनी कितेंय तुमकां कांय कोणी गरज आसल्यार इन्शुरन्सा विशांत कोणा लागीं इन्शुरन्स ना इन्शुरन्स नासतानय आमकां ट्रीट करूंक जाता कोणाकी केदळाय कांय कोणी कुमक जाय जाल्यार म्हाका कॉन्टेक्ट करियेत नाजाल्यार आतां तुमकां माहिती आसा हांव पाद्राबाग ताणें दिल्ले कॉन्टेक्ट शेअर करता आनी पाद्राब तुमकां कळयतलो देव बरें करूं आतां आमचे हेल्थ अवेअरनेस इन्शुरन्स तुमकां सगळ्यांकी देव बरें करूं